family medicine physician. Dr. Bayo Curry-Winchell joins us now. Dr. BCW, let's go ahead and start with something that really does apply to everyone, regardless of age, which is the question of vaccines. Which ones should we just even ask about during our annual checkup?
There are so many vaccines, and it can be hard to know which one. So I recommend the flu vaccine. Right now, we are seeing an uptick in respiratory illnesses. So that's a great one. COVID-19 boosters, shingles, all of those are great vaccines to start with and have a conversation with your doctor to see which one is best for you.
Dr. BCW, you say it's also very important to monitor our cholesterol. Tell us more about what we should be paying attention to.
Well, we know that cholesterol, especially high cholesterol, is linked to heart disease. And often people are not aware that their cholesterol is elevated. So I recommend anyone over the age of 20 get it checked out because you could be walking around thinking you're healthy, thinking things are fine. However, high cholesterol could be actually happening. So when you get it checked out, then you know.
It's interesting because I feel like a lot of these tests, they sort of use 40 as this cutoff. I mean, are there additional scans or tests that people who are approaching their 40 should sort of be thinking about or asking about?
Absolutely. So, what I recommend is when you are over the age of 40, start with a colonoscopy. Any adult over the age of 45 really needs to get a colonoscopy. The other thing is we can't forget about mammograms. So, any woman over the age of 40 needs to get that as well. And another thing people are not often aware of is if you have any family history of colon cancer or breast cancer, you need to have a conversation with your doctor because you might need to get it sooner than age 40 or 45.
You know what? I think I'm due for both of those things, and I'm glad for this little reminder because I think a lot of times for people, unless there's a glaring issue, you're in an immediate pain or having an issue, you don't prioritize going to the doctor. You are a doctor who helps people through this. What do you want to say to people who have been pushing off these important appointments?
Well, first, I want to recognize it can be overwhelming. Not knowing your health status can be hard to go in and say, I want to get this checked out. But it's the first step of being able to be healthy and do all of the things that you want to do. So if you've been kind of thinking, oh, I'm not sure if I want to go in, this is the first month to start that healthy trajectory, that investment in your health.
And as you said there, I mean, some of this is, people worry about cost, but there are community resources and programs to help.
There's so many things that are available now. I would recommend looking online. There are affordable options, especially for screenings such as mammogram, colonoscopy, as well as vaccines. So if cost is a big thing that you're worried about, check online, look at your community resources and go and just invest in your health. You've got this.
Invest in your health. We love it. Dr. Bayo Curry-Winchell, thank you so much.